Good morning, everyone, and welcome to Many Moving Parts. My name is Jason Pollick. I'm a registered social worker and psychotherapist in Ontario, Canada. And today we're sort of roughing it today. I am in my office in downtown Ottawa. The clinic's name is Intersections Therapy Collective, and we're located at 436 McLaren. And I'm in my office today, so I don't have my fancy lights and my fancy microphone. So the quality of the video might not be up to par. But I had a little spare time today in my schedule, and I wanted to record just a quick video about some frequently asked questions when it comes to therapy. So a few weeks ago on my social media feed, I put out a question. I'm like, what are some questions that you'd really like to ask a therapist, about the therapeutic process that you just may be too embarrassed to ask, or may want a little more clarification on what it's about. And so I got a number of responses back. And so I wanted to try to answer some of these questions, just so if any of you are considering going to therapy, it sort of demystifies the process a little bit. So the first question that people ask is, will my health insurance cover therapy? And that's a great question. Now, I can't speak for your individual plans, but if you do have a benefits plan, you are usually covered by private therapy. So what happens is, if you look at your benefits plan, your description, there will usually be a category that is, psychologist, social worker, psychotherapist. Those are different things, but they're usually considered the same thing for the purposes of benefits plans. And most plans will cover up to a percentage, usually around 80% of your therapy costs, up to a maximum dollar amount. And that maximum dollar amount can vary widely depending on your benefits plan. There are some who are covered for an unlimited amount of dollars. Some others are only covered for a maximum of $500 in a calendar year. So like I said, that can vary widely, but the best thing to do is to check with your benefits plan if you're seeking private therapy, which I am a private therapist. There are other avenues that you could take to seek out therapy. The waiting lists tend to be longer if you go with sort of government covered therapists. So if you wait for, an addictions counselor through a hospital, or if you wait through a psychologist or psychiatrist through a hospital. So sometimes your best bet is to go to psychologytoday.com and look up therapists in your area. And of course, the nice thing about the pandemic, but the nice thing about the pandemic is it really pushed the limits a little bit further in terms of virtual therapy. So 10 years ago, the concept of virtual therapy was almost non-existent. And now since the pandemic, it's very common. I would say probably about 80% of my clientele are virtual. So so like I said, the best thing to do is check your benefits plans, check with your carrier to see what your benefits plan will cover, but you usually can find some coverage through your Benny plan. The next question that came up was, how long will the process take? Well, again, great question, and that varies widely because everybody's needs are different, right? I mean, some people have had a troublesome incident that has come up in their lives that they really need to help process. And sometimes, quite literally, 3-4 sessions might actually do it, sometimes even 2. I have heard of clients who have gone for 1 session and been like, you know what, just getting that off my chest and saying it out loud has really helped me kind of put things back in place, and I feel okay. Other people, particularly if you are dealing with childhood trauma or PTSD, it can be quite a lengthy process. I mean, we're talking a question of months, if not years. And then other people take a different approach. Now, I see my own therapist. Most good therapists should be seeing their own therapist. And I see mine probably every 2 or 3 weeks. And I have been seeing the same therapist for going on 2 years now. Now, the problem with that is sometimes you can develop an unhealthy relationship. I don't mean unhealthy like toxic, but sometimes when you see someone for a long time, when you see a therapist for a long time, eventually the therapist will run out of tools. The therapist will run out of things that he or she or they can possibly give you. And so sometimes you need to change therapists. But that being said, there's also a value in developing a long-term trusting relationship with a therapist that in and of itself can be very helpful and therapeutic, particularly if you have issues with trust and have issues with abandonment. It can be really beneficial to establish that long-term relationship. So all that to say, how long the process will take really depends on what the needs are that you are bringing to the table. So how do I schedule an appointment? Well, I'm going to leave some helpful links down in the bottom of this video so that you can contact me or you can contact other clinicians at the clinics that I work at. I currently work for two different clinics, so Intersections Therapy Collective in Ottawa, and the other one I work for is New Mindset Therapy and Yoga, and that is in Cornwall. I see in-person clients there, and I also see virtual clients all over the province of Ontario. So you can usually schedule by contacting the clinics directly or by contacting the clinician directly. And so once again, if you go to psychologytoday.com, that is kind of like the Amazon of therapists. You can go there, you can look up the therapist that you want based on what your needs are and what your situation is. And then you can usually, they will have contact numbers or emails that you can get in touch with the individual therapist that way. So the next question is, what can I expect if I've never been to therapy? That is a fantastic question. A lot of people are intimidated by therapy. So they think that the therapist is going to talk about their mother a lot, or they're going to try to make them cry. So we do often talk about mothers quite a bit, and there's quite often tears in a therapy session, and that's okay. That is a great place for tears to come out. It is, for a lot of us, tears or sadness is unacceptable. In other circumstances, we may not be able to shed tears around our kids, around our parents, around our friends, around our coworkers. So therapy is a great place to let tears out if you have to, but the goal of therapy is not to make you cry. The goal of therapy is not to talk about your mother unless you really need to talk about your mother. What you can expect, I can really only speak for me because I am, a therapist with, different approaches to the therapeutic process, and my approaches are going to be different than the next person. But I practice what is called narrative therapy, and so that is therapeutic storytelling, for lack of a better term. So what you can expect from me is we're going to talk a fair amount about your childhood. We're going to talk a fair amount about significant life events. Excuse me. We're going to talk a lot about significant relationships, both past and present. We're going to talk about your work. We're going to talk about how you relate to different family members, different friends, different coworkers, how you relate to your boss. And we're going to try to tease out positive aspects of your story, and we're going to try to amplify those. And then we're going to take negative aspects of your story, and I'll get back to the positive negative thing in just one second, but we'll take the negative aspects of your story and we will try to reinterpret them. We will try to see them through a different lens and hopefully make them a little more helpful, make those aspects of your story a little more productive. Now, back to the positive negative thing. It has been said, of course, that there's no such thing as a positive emotion. There's no such thing as a negative emotion. Now, that being said, lots of us would love to be happy all the time, and we don't particularly like being sad or afraid or angry. Now, in reality, of course, there's no such thing as a negative or positive emotion. Sadness is an appropriate response to grief, for example, and fear is an appropriate response to something that is frightening. Anger is an appropriate response to something that angers you, right? I mean, that just sort of stands to reason. So the reason why I say there's no positive or negative emotion is that emotions are messengers. They tell us what we should be feeling. They tell us what we want to feel. They tell us how we are responding to certain situations or stimuli in our lives. In that sense, there's no positive or negative. They're just telling us what the deal is. So you can expect in a therapeutic session that if with me at least, that we will focus a lot on the emotions. You know, one tired old question that I ask a lot is, and how do you feel about that? Right? And sometimes that'll get a little bit repetitive and you might get annoyed with me, but our emotional responses to things really are the key to understanding ourselves, understanding our issues, our concerns, to understand our growing edges. So that's going to be key. We're going to talk a lot about feelings. That's what you can expect from me, right? But otherwise, you know, like I said, there's lots of different therapists out there, and there's lots of different therapeutic approaches. So, you know, like go on Wikipedia and check out different therapeutic approaches. Like when you go to psychologytoday.com and the therapist that you are considering says, I do DBT, dialectical behavior therapy, look that up. Look that up on Wikipedia and you'll get sort of a vague idea of what it's about. I mean, Wikipedia is certainly not the last word on anything, but it's quite often the first word. Okay, the next question that came up was, what area do you serve? So most therapists are licensed in a particular province, and some therapists are licensed in 2 or 3 different provinces, depending on what their background is and depending on what area they want to serve. So I'm in Ottawa. I am currently registered only to work in the province of Ontario, so I can work virtually with anyone throughout the province of Ontario. It would make sense for me to get licensed in Quebec just because of our proximity to Quebec. But so far I have yet to do that, but maybe that's coming in the future. If you do live in Quebec, you can come across the river and you can see me in person at our clinics. What is really important is that whoever I see has to have a permanent address in Ontario, or they have to actually physically be in Ontario for the session. So for example, I have seen clients who are on vacation in Costa Rica, and I have seen clients who are on, a work, a work event in Spain. So just as long as you have a permanent address in Ontario, or you physically attend the session in Ontario, I can serve you. Next question is, can I do therapy virtually? Again, another great question. I touched on this just a little while ago. Virtual therapy is now very common. And in fact, it is, I would say it has become the norm. There are some therapists who only see clients virtually, and that's because it is just easy, it's convenient. Excuse me. You don't have to get dressed up, you don't have to drive, you don't have to find parking, et cetera, et cetera. Now, those are some of the benefits to virtual therapy. There are some drawbacks. It is a little harder to establish a relationship virtually. It's a lot easier to do that in person because I can't remember. I read somewhere that like 70% of human communication is through nonverbal cues and body language. I don't know whether that's true. That's just a little tidbit of information that's coming to my mind. But I do know that a lot of human communication does happen through facial expression, posture, body language. And you don't really get that when you only see someone from sort of, the chest up. So I know that I find it a little more difficult to read people when I am doing sessions virtually, but it's not impossible. And like I said, a lot of people actually prefer it, especially if you have, if you have kids, or if you have, a weird work schedule, or, if you have social anxiety or mobility issues. The rise of virtual therapy has been a huge boon to people seeking therapy. Next question that comes up is more a personal one. What is your treatment approach? Well, I've already sort of touched on that. One of the things that I do, like I said, is narrative therapy, which is therapeutic storytelling. I also incorporate elements of what is called motivational interviewing. And I will put, again, I will put links to all of these different modalities down in the link section. So motivational interviewing, to put it broadly, sometimes when you are considering change, there is ambivalence, there is resistance. So sort of a classic example would be someone who acknowledges that they drink too much alcohol. They have an abusive relationship with alcohol. They recognize that they want to quit, they have to quit, but the problem is there's an upside to drinking. Drinking makes you feel better. Briefly, right? In the long term, of course, it is not a viable strategy for wellness and mental health. But in the short term, when you have a few drinks, it relieves stress, it relieves tension, it relieves depression. I mean, of course, when you wake up the next day, those things are all worse, as we well know. But motivational interviewing tries to take into account the fact that any problematic behavior that you're trying to get rid of, that you're trying to keep under control, has its upsides. And there is some fear or ambivalence or reluctance or resistance to change. So motivational interviewing addresses that. I also practice cognitive behavioral therapy, and cognitive behavioral therapy is kind of like the gold standard. It's the evidence-based aspect of therapy. And it seems to be the most popular type of therapy. Most therapists practice cognitive behavioral therapy. So in brief, cognitive behavioral therapy, or CBT, acknowledges that there is a link between your cognition, what you think, and your behaviors, how you act. And this relationship is reciprocal. So what you think is going to affect how you act, how you behave, and how you act and how you behave is going to have an impact on how you think about yourself and your world and your place in it. So what CBT tries to do is to locate and identify problematic patterns of behavior or patterns of thought, and it just tries to bring those to the surface and tries to resolve them, tries to find a more productive way of acting or a more beneficial way of thinking. That's it in a nutshell. Now, I also practice dialectical behavior therapy. That is a little more complicated. But dialectical behavior therapy is a therapy that helps you regulate your emotions through some mindfulness techniques. It also helps you develop some, social skills, and it helps you develop the capacity to hold two conflicting thoughts, in your mind. So rather than be frozen by ambivalence, it helps you address ambivalence and to hold those different dialects in place. One of the things that was really helpful for me when I did dialectical behavior therapy for my PTSD, and I did that through a 9-week program at Homewood in Guelph. The nice thing about dialectical behavior therapy is the thought record, right? And that is that I have a thought like, I'm a loser, right? And then they take you through this dialectical behavior therapy takes you through this whole process where you're like, okay, what is the evidence that supports I am a loser? What is the evidence that goes against I am a loser? Okay, and I'm abbreviating this, but there's a whole long process that really helps you restructure your thought process to be like, okay, this thought that is really troublesome to me, how realistic is it? And anyways, I found that really helpful. So how much do you charge? Another great question. So my rate in Ottawa is $160 an hour for individual therapy, and for couples or family therapy, it's $190. Now in Cornwall, just because the cost of living is a little cheaper there, I offer services a little more cheaply there as well. So it's $135 for individual sessions and $155 for family and couples therapy. Now, there is those are not rates that are necessarily set in stone. I do offer a sliding scale if finances are a bit of a problem. Next question: do I need a referral? no referral is required for my services. And if you look up your therapist on psychologytoday.com, there is typically no referral required. You don't need to go to a doctor or a nurse practitioner or another healthcare practitioner. You can just look us up, give us a call, and basically self-refer. Say, I'm having some issues. I'd really like to talk to somebody. So I am going to take a brief pause right now because it is 5 to 10 and I have another session. So I am just going to pause this. You're not going to see this, but I am going to step into a session and then I will continue with a few more questions. So we'll see you in a second. Okay, so we are back for round 2 of Ask Jason, Ask a Therapist. The next question that I had is what is the process of getting into therapy, and what can I expect from the first session? So this is another great question, and it's not necessarily the most obvious thing in the world. So I'm glad that this question got asked. But what normally happens, so not all therapists are equal. And I don't mean they're better than others, but different therapists have different approaches, different specialties, different things that they can help you with. Not all therapists can help you with all problems. So, for example, there are therapists who are specially trained in eating disorders, in sexual trauma, in helping you overcome PTSD, in all sorts of different areas, for all sorts of different issues. So what you would normally do is you would contact a therapist. You could go to psychologytoday.com, or you could go to your EAP program, your employee assistance program, and what will happen is you will get set up with a therapist. Most therapists will have their bio on psychologytoday.com, and you can look them up and read a little bit about them and be like, okay, this guy sounds, or this girl or this person sounds like they might be a good fit for me. And what you'll normally do is give them a call or send them an email and arrange for a 15-minute consultation. Well, at our clinics, it's 15 minutes, but sometimes it's longer. Sometimes they just set you up with a session. But under normal circumstances, a therapist will offer you a free consultation, which is sort of like a little meet and greet where you tell them a little bit about what's going on in your life. They tell you a little bit about their approach. And then at the end of that conversation, you decide whether you think you are a good fit. Now, bear in mind, it's not a marriage, right? You can kind of be like, okay, it sounds like it might be a good fit, but I might change my mind a ways down the line. That's okay. You can do that. So what'll happen is at the end of that conversation, you will both come to an agreement. Either you feel the therapist can help you, and the therapist feels that they can help you, or not. And in which case that therapist might be able to help set you up with someone who might be a little more attuned to your needs and your concerns. So after that session, assuming you decide to go ahead with a session, the first session is generally an intake. So there's probably not necessarily a lot of therapy that's going to happen, not necessarily a lot of tools, but the intake session, I like to call it a high altitude flyover, where you kind of, the therapist will generally ask you some questions about your upbringing, about your past, about your current situation, just to figure out a little bit about who you are and what you were bringing to the table. The other thing that will often happen at an intake session is you will discuss goals, right? Like, what is it that you want to accomplish in therapy? What is it that you would like to see happen in your life? What are the trouble spots that you would like to acquire some tools in? So anyways, that's generally what will happen in the beginning phases of therapy. Now, where therapy goes after that will depend largely on your goals, on the therapist's approach, and how you respond to that therapeutic approach. Closely related to that is a question that was asked: what is the goal of therapy? And I hate to be that guy again, but that largely depends on your goals and what you want to accomplish and what your issues are. I guess if you were to put a gun to my head and say, you have to come up with a goal for therapy, the goal of therapy is to improve your quality of life. Now, whether that is to overcome trauma, whether that is to overcome social anxiety, whether that is to come to terms with grief, whether that is to process emotions that you were not allowed to express as a child, it's the list is really endless. But the goal is, I guess, to help you move past obstacles, to help you capitalize on your strengths, and to help minimize the negative impact on your life of some of the obstacles that you're experiencing. But your goals are really going to be individual. They're going to be your own. Um, Another question, and this is a great one. What is the difference, anyways, between a psychotherapist, a registered social worker, a psychologist, a psychiatrist, a life coach, etc.? Um, to an extent, this is going to depend on what province you're in and in what country you're in. But here's the quick and dirty version. Okay, a psychiatrist is, what people hold up as sort of the paradigm of talk therapy, but very few psychiatrists these days do talk therapy. Sort of the classic example is Sigmund Freud sitting there with his cigar and you laying on a couch and telling me about your mother and all that sort of stuff. In reality, that was the way psychiatry started, but very few psychiatrists do talk therapy anymore. So most psychiatrists are medical doctors. Okay, they have a doctorate, and they are the only healthcare professionals that are qualified to administer and prescribe medication and to adjust those meds. Realistically, any other therapist is not supposed to have an opinion on medication or to advise you in matters of medication. A good therapist might suggest that you go talk to your doctor about the possibility of medication, but other branches of therapy are really not supposed to have an opinion on that. A psychologist is someone who is specializes in the study of mind and behavior. What distinguishes a psychologist from other psychotherapists, and sorry, maybe I should back this up. Psychotherapist, psychotherapy is an umbrella term that applies to a variety of different healthcare professionals. So it applies to psychiatrists, it applies to psychologists, it applies to registered social workers, it applies to registered psychotherapists, which is a new sort of subdivision in the Canadian context. But basically, a psychotherapist is anyone who uses talk therapy as opposed to medication. So a psychiatrist, for example, can do psychotherapy and also give you medication. But the other branches like psychologist, social worker, registered psychotherapist can only use talk therapy. So what distinguishes a psychologist from some of the other branches, and this is true for psychiatry as well, is that psychiatrists and psychologists can administer standardized tests. So for example, there exists for a number of mental health concerns standardized tests that you can take that will help a healthcare professional assess whether you have that problem. So for example, there is a PTSD standardized test that you can do. There is an addiction test that you can do. There are all sorts of standardized tests that you can do, and a psychiatrist and psychologist can administer those and evaluate those. There's really no other branch of psychotherapist that can do that. These tests they often come at a cost unless you're in a hospital and it's being administered through the psychiatrist or the hospital staff. But lots of tests can be done through private therapy as well. You just need to look up a psychologist or a psychiatrist. So a social worker is qualified to assist you with a number of mental health concerns. We are allowed to call ourselves psychotherapists. We are not registered psychotherapists because there is a college of registered psychotherapists in Canada now, but we do practice psychotherapy. And typically a social worker will specialize in certain issues or concerns like substance abuse, depression, anxiety, PTSD. But social workers use talk therapy as well. So we are psychotherapists, but a social worker will have, I think, more so than any of the other branches, will have an overarching concept of some of the systemic issues that lead to large-scale mental health concerns. And we typically tend to be fairly vocal advocates for policy change and just, shifts in government attitudes towards mental health. It's not to say that the other branches don't do that, but the term social work is that we are interested in sort of the social aspects of mental illness and mental health. The other thing that people often bring up is a really popular thing now, and it's called a life coach or coaching. Now, it's I think life coaches serve their purpose. They have a niche, but a life coach is not a therapist as such. I would go to a life coach if I was having trouble in my workplace with my work performance, or if I wanted to start my business. I would go to a life coach. If I wanted to, I wouldn't go to a life coach for emotional problems, psychological problems. You wouldn't go to a life coach for trauma, childhood issues, that sort of thing. A life coach is more geared towards supporting you in your career, in your life goals, and in achieving the lifestyle that you want to achieve. So not talk therapist as such, and certainly not a psychotherapist. So anyways, that's just about it for me today. These are the questions that I have received, but of course I am totally open to any other questions that you might have. So please feel free to contact me, either on my social media feeds or my email or my webpage. And I would be happy to put together another session where we talk about your questions regarding mental health, mental illness, and mental health recovery. So take care. Have a great day. Thank you for listening, and we'll talk to you soon. Bye-bye.